Sir is a member of the National Institution for Transforming India.
Thank you very much. Sorry. I should stand, not all of you, please. Thank you. Namaskar, good afternoon. Apologies for a little delay. No working day, just happens. Most respected Dr. D.S. Rana ji, Dr. Ajay Swaroop ji, Dr. Kotwal, Dr. Bhalla, Zoya ji, and in the audience, my very distinguished teacher, Dr. Nandi sir, my very distinguished mentor, Dr. Ganguly sir, my buddy somewhere here, Neelam, went away for a long time, and very distinguished colleagues from family of Sir Gangaram Hospital. As you know, I consider myself to be an extended part of this family because you represent both excellence and values, and I have been a lifelong admirer of this great institution, this great hospital. So my salute to all of you. I'm so honored to be here. So honored to be here. And I would like to place on record that under the leadership, today's leadership and the leadership of several years behind us, you have brought health sector to different heights. You have created a name for yourselves, and rightly so. And I particularly admire, among many things, on item number 7, I admire the fact that you run the largest National Board of Examination DNB system. What a example you have created. You are an example in this, in many areas. Your academics, research, education, values, standing, advanced care, and so on. So it's very heartwarming for me to be here. I like to now compliment both NHSRC and team for undertaking this very insightful study. Simple idea, but very well done. So I truly appreciate that you brought to fore a very important issue that plagues our young children, adults, youth, perhaps all of us in a way. So thank you very much for doing it. And as Major General Kotwal said, it has profound implications, and such studies are a wake-up call for us. And I think you did cover this in the newspaper. If not, please do so. Let people know. And one aspect of what we should do is truly the awareness that we need to do. To me, there are two major inputs or results that are emerging. A quarter of children in schools are not sleeping optimally. I had expected this to be a higher number, but this is truth. 22%, 23%. But the bigger elephant in the room, if you see, is 60% not being, 60% having some form of depression. So actually this study should, outside title should be Prevalence of Depression in School. Please don't let that be buried in the title. That is a bigger news, and a quarter of them are moderate to severe. What the hell? 1 out of 4 of our children in Delhi are moderately depressed, 60% somewhat depressed, quarter not sleeping. So this is bringing to the fore a very major issue of our children, particularly adolescent children. Before I lose track, I want to say that if you do this study in the college going students, and please do so, and let's do it, that all of us do it, we'll be happy to help you. This is a bigger problem, for sure. एक स्कूल का बच्चा अगले दिन तो 9 बजे जाता है ना, 8 बजे, कुछ ना कुछ तो रेजिमेंटेशन है. कॉलेज वाला तो ना जाए तो किसको पता चल रहा है आजकल. And on this, I have been, as my colleagues mentioned here, we've been looking at this issue at NITI in a very systematic way for the last few years. And out of that grew a curiosity to ask young people. I haven't gone to school, but I go to universities and these convocations and Think like that, and I would ask, अच्छा आप honestly आप बच्चों बताइए कि ये कॉलेज हैं NIIT this that मेडिकल कॉलेज also जरा हाथ खड़े करो जो कल 24 घंटे में 7 घंटे सोए हैं. So I've done my survey. Only 1 out of 5 hand comes up in the hall. 1 out of 5, 1 out of 3. This is a profound problem. It's an outbreak. Welcome, Neelamji, I was missing you. You are declared buddy. Okay? So, it's a huge problem. From experience, my younger son, he was in college, law and everything. And he was in a university in Jodhpur. वो 3 बजे सोते थे वहाँ बच्चे, ऐसे 12 साल 10 साल पहले की बात है. So when at home, or 3 o'clock, so when at home he started sleeping at 1, I thought it was a huge improvement after persuasion. The point I'm making is there is a bigger problem for the youth who are going to be the energizers and the implementers of what we aspire to be in 2047. That's the workforce. This is the workforce that we are dealing with. Quarter of them are not sleeping. Perhaps half of the college students are not sleeping. I think such issues should be brought to forth. And I have a temptation to also share one more data set on this. Somewhat unrelated, also related. Anemia. ये hidden है, इनकी बातें हम करते नहीं हैं. Anemia. NFHS and another survey from ICMR more recently using venous samples. 55% of non-pregnant women across ages have anemia. आप उसको 50 ले लो. But that's only half the story. Dr. Ganguly sir, half of them, that means 1 out of 4 have moderate anemia. Now 9 gram or below is not normal. You can keep on testing mild है मुझे कुछ नहीं होता. 9 से कम 1 out of 4. और adolescent girls में 40%, 50%, we know that. How can cognition be normal? Typically, overall incidence of anemia, half of it is moderate to severe. We did a huge, exercise in looking at literature this way, that way from ICMR team as well as he was involved. And half of it is typically, or just above half, is typically iron deficiency. Another direction. The point I'm making is these problems have to be brought to the fore. Women workforce, at home or otherwise, how can 1 out of 4 can be fully functional, even for household chore, for as teachers, as doctors, as nurses, as shopkeeper, as worker? How can it be normal? तो थोड़ा सा मैं चाहूँगा कि इसके बारे में नॉलेज बेस को बढ़ाने में मदद करें. ये सामने आना चाहिए. This is our workforce. If you don't sleep, how am I productive or optimally productive? I wonder whether those competing nations also compromise like this. They knock off, let's say, 2 IQ points dysfunctional because of anemia. And that's a collective loss of productivity. So I want us to think like this, but today it's on sleep, but the hidden story and the elephant in the room is depression. The two can have a link, but they need not have a link, and therefore please showcase this as a survey of sleep and depression both. And I urge you that we continue to work particularly for the young people in the colleges and of course elsewhere. That would be my request. Now a mention has been made to redesigning the school health program. Or improving school health program, making it more comprehensive and effective. Firstly, again, do we have any example from any study how a school health program should look like? The answer is no. Where is my community of academics doing work on this? We haven't designed one. In good old days, when Dr. Ganguly would tell us why ORS should be used in diarrhea, we would satisfy people like him and other leadership globally and nationally. हम mortality decrease करके दिखाते थे कि diarrhea ORS देते हैं तो dehydration कम होती है, death कम होती है, mobility कम होती है. हमारे पास example नहीं है of a good school health program. What do we bank on? So we did the second best, which means collected information from here and there, looked at best practices, bits and pieces. But comprehensive school health program models, because there cannot be one model. Models are not on the ground today. But we did the second best, worked hard, systematically, and so on. And here are some thoughts on how it might look like. The pillars. They can be redesigned, they can be, readjusted and jigsaw. But the pillars that emerge are the following. First, curriculum. Teachers tell us कि जो curriculum में हम वो पूरा करेंगे, and they also tell us that curriculum stays, and we all can recall कि हमने कुछ vegetable अच्छे होते हैं या exercise अच्छा होता है, कहाँ सीखा? Curriculum से आया तो टिक गया. बाद में जो आता है वो top up है. So the curriculum plays a very important role. Fortunately, we have the opportunity to work on the curriculum framework, which was happening in the wake of NEP, and taking help of people who are in the game. We saw the missing pieces, few, and we said that these should be included. So hopefully, the national curriculum will reflect, but then there are other curricula. States have their own curricula and so on. So be mindful. Can we contribute toward better curriculum? Can we spot the problem? Can we make it more interesting? Can there be supplementary reading that children can do? This is children. By the way, college, hospital, तो अभी सोचा ही नहीं है. Second element is which is again an obvious and we must promote and enforce, is the good old sports, physical PT or physical activity, to which we can today with confidence add yoga, and I urge add meditation, because there is enough evidence that it does good things. And so this space of wellness, yoga, meditation, physical activity, sports, I think this bandwidth, Fit India, this is the second pillar, and let's not lose it. We always, in fact, this was always there for whatever origin it had, but that's the second pillar which must be enforced. The third pillar is a health promoting environment of a school. We learned it from a global movement on health promoting universities and tried to look at what it would mean for a school. So it would mean things like hygiene, toilets, good water, canteens that carry food, good food, tiffins that promote healthy food, tobacco 30 kilometers away from the school, alcohol ko naam hi nahi hai, substance abuse nahi hai, or an environment of health ताकि visible रहे, talks and so on. So create an environment in which there is health is visible, because if you're healthy, we know the importance here of the health, so I don't have to say. It's also about, school health clubs, children talking about health, campaigning on good, say World Health Day or whatever, good food day, talk about it, generate awareness amongst themselves and even into the community. So that's the health promoting school, which has multiple elements. The fourth pillar is mental health. This is today virtually non-existent or totally informal. In the wake of COVID, there was a Mano Darpan portal, then we brought out Telemanas, but they are independent. What is so special for them for the school? खास नहीं है. Mano Darpan है, Telemanas सबके लिए है. Now on this one, because this is a scientific gathering, we worked with the best minds in the country and also looked at the global paradigm. And here are the two approaches, two pillars and then sub-pillars. One is, again, a school environment and school policies that promote positive mental health. And I like us to think. So let me just share, because mention was made. So what does it mean? No bullying policy. हम सब जो कमज़ोर बच्चे होते थे, हमें लोग धक्के मारते रहते, ठीक, जिसको इंग्लिश नहीं आती थी तो उसको भी स्टिग्मा होता था. ये एनवायरनमेंट में नहीं होना चाहिए, राइट? कोई मोटा है उसका स्टिग्मा है, कोई बहुत पतला है उसका स्टिग्मा है, कोई कुछ है तो उसका, तो नो स्टिग्मा. आई एम जस्ट हाईलाइटिंग अ फ्यू. जेंडर, नो स्टिग्मा, नो बुलिंग, नो डिस्क्रिमिनेशन, safe spaces, safe cyber space, declared policy that nobody, and so policies, school policies, approachable teachers, approachable principal, hierarchies being soft, caring environment. So I'm sure systematically such things can be done, at least they can be enshrined. So that's about the first, mental health. This counterpart of the healthy environment, but in the context of health promoting school, but in the context of mental health, things become somewhat specific. Then confidentiality, if somebody says that. But the other second part is how do you actually do it? There is the first component of that is universal access to this that I mentioned. Second is that if the where teacher has a role, teacher and parent, if they spot an early problem in the child, they come together. Now, how do they do it? They need to be told, they need to be educated. Those would be the tools that Zoya's team would develop. कैसे टीचर मदद कैसे करे? हेल्थ एंड वेलनेस एम्बेसडर में ये कवर्ड है थोड़ा सा, लेकिन इसको प्रोफेशनल लेवल पे थोड़ा सा जाना पड़ेगा, लिटिल बियॉन्ड दैट कॉमन सेंस. So that is the first part. Second level is when the child has a real problem. That would require access to expert help. No way. Then you need counseling. You need to go somewhere. You need to receive counseling through a system. And the fourth one is when there is a crisis. Overt crisis, which is an emergency, which is tackled in a different way. So these are the four, just to say that this is what we learned talking to people, and this is the WHO paradigm that we used. I'd like us to bring more thinking around it, and if you can craft a school health program for the adjoining 4 schools, let's all sit down and do it and make it happen. दिखाइए हम इससे भी और अच्छा बन जाएगा. The fifth tool is famous screening tool, which means anemia, eye check, heart check, and so on and so forth, which is part of RBSK. And the last one is first aid, a place where child can stay, पेट का दर्द ठीक हो जाए, खांसी जुकाम ठीक हो जाए, maybe epilepsy है, उसका treatment का कुछ emergency. And then special provisions such as the menstrual hygiene products, such as maybe tomorrow HPV vaccine, yesterday COVID vaccine. So these are the 6 broad pillars, and I'm sharing with you just to let the word spread, because these are not yet done. These are what we sort of ended up with. But there could be further refinement with the ministry's undertaking, and also how to implement. That's happening. So I'm happy to report to you that there is a systematic effort. But at the same time, like academia, NGOs, institutions like us, people like us, to show that this is how it works. What are the learning? Which is weak area? How do you get the teachers to be a part? How do you get parents to be a part? So also we talked about institutional mechanism like school health committee, which has parents, which has doctors from the health system, and so on. So this is some early thinking, but please inputs on this are invited. Likewise, we would need the paradigm for the colleges and so on, primary care, but also health promotion, and that is a work that we perhaps will take up to design. Having said that, we have learned that sleep is important for energy, for well-being, for better immune function, for thermoregulation, tissue recovery, above all consolidation of memory, cognition. It gives you symptoms. All of us get headache, irritation, right? Lack of concentration. There's a huge price that we pay. Now, one aspect which is more contextual today is been pointed out is the screen time. I think awareness, this is another hidden, sort of invisible elephant here. Screen time is a very major reason, and I think that should be, I'm sure if you have data, you please highlight that. And screen time, I was told, we learned that it switches off the blue spectrum of the light, switches off the melatonin. It takes, once you switch it back to dark environment, it takes 1 hour to come back. I like this word to be spread. Even the medical college students better learn about this, because this is really at the heart of the problem. There is a biological, physiological explanation for this. And therefore emerges out of this the education about good sleep and sleep hygiene. So first and foremost, switch off the laptop screens and so on. We start talking about it. Then no coffee. Coffee is a stimulant. We know it. Read a book, low light, darkness, switch off, maybe little concentration. तो क्या इस तरह के हम as a fraternity of scientists and clinicians develop these guidelines? I'm sure they are there. Can we improve upon them? Can we use this to spread the word? So I think that is something that should really not wait for policy and the programs to happen, and we should do it. I would also like us to really spread the good word that 7 to 8 hours sleep is normal, less than 6 is abnormal, and a habit of sleeping and a good quality sleep also has some other elements should be promoted. So requesting you to develop materials that we can promote raise awareness in our own way for in schools and in colleges even more, I guess, because the problem is even more profound. Anxieties are even worse there. Secondly, I'm requesting for us to create models of health of the adolescents in schools and in colleges and so on. And above all, I would request that the dissemination of the work that you have done should happen very systematically. And once again, I congratulate the research team, and a big hand to the research team, please, and the two partners, and for the institution to have blessed this effort and having come at this dissemination in such a large number, so many seniors you have come. It shows the value you attach to this kind of a work, and in particular to the cause that we have today. With these words, my gratitude. Thank you very much.
And we need his blessings.
आप सबको मेरा नमस्कार। बहुत सीनियर टीचर बैठे हैं ऑडियंस में, इनको स्पेशल आदर से प्रणाम। I think Dr. Kotwal and Dr. Zoya covered regarding government policies on adolescents' health. Dr. Jayashree also covered some aspect of that. I thought I will just cover our chief guest, that many of young people may not be knowing that. It is being presumed that everybody knows him. We are very happy to have Dr. Paul here today, who is our shining star in the health star in the government of India and doing this UN service for the last 5-7 years. Let me tell you that he was professor of Paediatrics at AIM New Delhi. Very brilliant student right from the beginning. Of course, you can imagine that he became professor by virtue of that. But he was par excellent and a very teacher, astute clinician, and above all, a researcher. He had done a lot of research, and he is well known for that throughout the world in his department, in his fraternity. We are proud to have him today here, and we will listen to him. I especially feel very honored that he belonged to my state, Himachal Pradesh. So, yeah. And today, the officer who is sitting here, he is also from Himachal Pradesh. Zoya, Harasin is also from Himachal Pradesh. Anyway, now let me tell you that regarding star performer today, for whom you have all gathered here, and she is Dr. Bhalla. I just remember when 1987 Dr. Bhalla joined me, and later on she was thereafter looking after her kids. Then we persuaded her to take up Paediatrics, and she did BNB from this hospital only. And later on, few years back, she chose to take up this specialty, which was not existing, and she took up adolescent pediatrician. Let me tell you, I know them very closely, just like our own family. She is a very pious, spiritual lady, as far as her home is concerned. But she is very dedicated and devoted. She has taken up this cause, and today she has come up with one report. She has lot of other reports also. She is supporting schools in other ways also. And I tell you, Latika, please take up this with your devotion. You will be able to contribute to the growth of the country, because school health, the health of school children is very important. These are formative years, and I think we have to start from we are like, let us say, we have to take the care of people in not once they are born, but antenatal period, and after that, once they are grown up and they are in schools. It is here, this is very challenging now, especially today, It has become very challenging now that with the technology, we were just discussing that telephones, TV, they are double-edged weapons. It's not like that they are only harmful. They are also very good. They are very amazed, that whether genes have changed or whether what has changed. But the child, today child at age of 1 year, 6 months, they are almost living like adolescents. So, and adolescents. So, I think with this we are very glad that we have taken this and you have taken this specialty. And I'm very sure that administration will give you all help. And very grateful to Dr. Kotwal that he has given grant for promotion of this specialty in this hospital. Thank you. With these words, thank you, and we'll be waiting for the Dr.
Sir is deeply involved in expansion projects to propagate and the working model of Sir Gangaram Hospital, and his passion is to take this organization to further heights. Over to you, sir.
Well, good afternoon, ladies and gentlemen, dignitaries on the dais, off the dais, colleagues, friends, ladies and gentlemen. It is my proud privilege as chairman of Sir Gangaram Hospital to welcome you all today for this very, very momentous occasion. As you all know, every age group has different clinical problems, be it pediatrics, be it geriatrics. Adolescence is an age which is affected both by endogenous as well as exogenous problems. So this study which has been conducted by, and I must congratulate Dr. Latika Bhalla, she has always been at the forefront and she has brought laurels to herself as well as to Sir Gangaram Hospital, and I deeply congratulate her. And of course, Major General Kotwal, who has been so helpful. We have signed an MOU and it is being taken forward. And this study, I am sure, will be a benchmark for policymakers to look after problems of adolescents. And without further ado, I again welcome all of you. Thank you very much.
Yeah. Hi, good afternoon. I would just like to clarify first. Okay. ठीक है, I think I can just. Yeah, okay. So thank you so much. I think as Dr. Atul mentioned, I'm amidst such stalwarts of health. So I will not try and keep it from the health perspective, but I'll keep it from the policy and program perspective, which many of you may not be aware. Just to clarify, first thing, I don't look after family planning. I look after nutrition programs besides the adolescent and school health programs. And that is why the study becomes really so important for the ministry, because this is first of its kind to look at the sleep deprivation. All of us have been struggling, I think, as parents, as aunts, uncles, with children who don't listen to us. And this is something which is across all ages, whether your child is 10 years old or 19 years old, as the classic definition of adolescent actually happens. But just to give you a small point about what the programs are all about, we have one Rashtriya Kishore Swasthya Karyakram for the last almost 10 years, which is looking at supporting adolescents by giving them services at facilities, at communities, as well as schools. So that vision has always been there to work with children wherever they are, wherever they access, whether they are coming to our health facilities, whether they are in communities and out of school, or they are still in school. So, in fact, continuing with that, we strengthened it further by launching a school health and wellness program in which we are looking at training teachers to talk about health and wellness in schools, and that we believe is one of the very important interventions, because children spend about 7 to 8 hours in school, and that is a time in which the behaviors, all of you must be aware that whatever behaviors start in adolescence are the behaviors which end up affecting the adulthood illnesses or better behaviors. So that is why the inculcation of good behaviors, good knowledge, and good power, I would say not power, information is very important for children going to school, and that is why involvement of school was important to train, to I think say inform the children through the teachers. And that is why the study becomes important, because that is one feedback which keeps coming back to us from the Ministry of Education, is that what more can they do for the children, what more can they inform the children about how to keep themselves healthy, how to perform to the fullest, how to give themselves best academically as well as sports wise. And this study has gone ahead and shown us something which is, I would say, startling in the sense that the percentage of children who had depressive symptoms is almost, I think, 40% did not have depressive symptoms, the rest of them had depressive symptoms. And we do realize that for a growing child, health is very interlinked. So if you have lack of sleep, you will end up having some mental health issues. This may lead to nutrition problems. This may lead to even wrong decisions being taken regarding your sexual reproductive health also. This may also lead to substance misuse. So everything is very interlinked for adolescents, and that is why I think as a policy we are very aware of any new changes which are happening, new studies which are coming forward, which are informing any change in policy, any new interventions which will inform and improve the program. So we are happy to learn in the ministry, and I'm here as one of the person who will learn, and we will take this intervention forward. Only two things I would like to say is that since we are looking at evidence-based intervention, I would request, this is one study, if we can have more and more studies which are targeting adolescent and young people, is something which will help us as a country grow stronger, because our interventions will show evidence of what works and what doesn't work. And especially in a country like India, where I think one state is not like the other state, any knowledge from one state may affect the interventions of another state. But I would request you, because all of you are doctors, you have your colleagues in other hospitals also, in other states also, so to undertake studies which are targeting young people, children in school or out of schools, because that is what I think the future of our country is. We have to continue investing in them and doing what is best for them. Thank you so much.
All the invited guests, ladies and gentlemen, and all my colleagues and juniors. It gives me great pleasure to welcome all to today's meeting focused on a topic of growing concern, sleep deprivation and its impact on cognitive function in adolescent. In our changing world, adolescents are unprecedented, academic, social, and under digital pressure. Sleep, a fundamental physiological need, often becomes a casualty. Research has increasingly shown that chronic sleep deprivation not only affects physical health but also significantly impairs cognitive abilities such as memory, attention, learning capacity, and emotional regulation. These disruptions can have a lasting consequences on academic performance and behavior. And today's gathering brings experts from various disciplines, pediatricians, psychiatrists, neurologists, educationists, and public health to explore the scientific insight, clinical observation, and practical intervention related to this critical issue. It is through such interdisciplinary dialogue that we can understand the depth of the problem and work towards effective strategies to promote healthier sleep habits in our youth. I express my heartfelt gratitude to Major General Dr. Atul Kotwal sir and Dr. Ajay Swaroop sir for collaborating by signing MoU between NHSRC and Sir Gangaram Hospital, and that is how we were able to take this study to this level. I thank each one for being here and for contributing your time, knowledge and passion. So let's use this platform not only to information but to inspire action so we may safeguard the cognitive well-being of the next generation. So warmly I welcome you all again and thank you so much. So conducted in a single district restricting generalizability, did not assess screen time, diet or physical activity. Cross-sectional nature prevents causal conclusions. So I would like to acknowledge Dr. D.S. Rana sir, Chairman Sir Gangaram Society, Trust Society, Dr. Ajay Swaroop sir, Chairman Board of Management Sir Gangaram Hospital, with the and Major General Professor Dr. Kotwal sir, Executive Director National Health System Resource, for doing the MOU under with the NHSRC and the Gangaram Hospital, and this was the first study which was undertaken under this MOU. Dr. V.K. Khanna sir, Director Institute of Child Health, Dr. Seema Patrika, she was from AFNC. She did all the data analysis, which was the most difficult work, and Dr. Kanlan Arun K. Yadav supporting during the proposal development. Sir Gangaram Hospital Research Site and Institutional Support, participating schools and students, and National Health System Resource Center. Thank you very much. Arrived in Delhi. This study aims to bridge the gap through data, insight, and proposed possible solutions. So what are the primary objectives? I welcome Dr. D.S. Rana sir. To estimate the prevalence of sleep deprivation among the school-going adolescent population in the age group of 12 to 18, and to assess the association between the sleep deprivation and cognitive function. And coming to the secondary objective, to understand the various factors influencing the sleep deprivation, assess the association between the sleep deprivation and depression or mental health disorder, and to assess the influence of sleep deprivation on school absenteeism and academic performance among adolescent children. To understand sleep hygiene practices, which is followed by the school-going adolescent, their sleeping pattern as well as daytime sleepiness. So this was the flow of prerequisite which was done by us, starting from the education department. Permission from the education department was taken, which was obtained by the approval from the nodal officer to initiate the study in schools. Meeting with school principal, which was very, very important. We visited each school, discussed the study, and secured permissions for the data collection. And data permission was taken from the parents. They were individually, we had taken permission. It was a written consent and consent which was signed by the child as well as by the parent before starting any kind of a data collection. So orientation of the teacher was also done. The various informative sessions to explain the purpose as well as the methodology to the teachers were also explained. And then finally we had to do the awareness workshop with the students also. We had to engage students through the interactive workshop to familiarize them with the study process. And of course then this was the study rollout. Data collection began with structured understanding from all stakeholders. So design is analytical cross-section study. So there were four tools which was used. One is the Pittsburgh Sleep Questionnaire, and then is the Montreal Cognition, and then PHQ-9 is a Patient Health Questionnaire, and ASH is Adolescent Sleep Health Scale, these were done in most of the school. Either were government school, they were from the private schools also, but then there was a Hindi there was a Hindi modification also. So because we had children who were in our study from the government schools also. So sampling method was systematic random sampling to ensure representation across all the school types, and 1521 students aged 12 to 18 years from 9 central Delhi schools. So the key findings were, so 22.5% of adolescents reported being sleep deprived, reflecting a significant concern for mental and physical health. And coming to the depression, we had mild, moderate, 40% were not depressed, 32.9 had almost mild depression, and moderate to severe was 27%. So 60% of participants showed depressive symptoms, highlighting the urgent need for mental health interventions. And coming to the cognitive function in adolescent, which was done by the MoCA, so almost 34.3 had a normal cognitive function and 65.7 had a poor cognitive function, which was assessed by this questionnaire. So 65% of adolescents demonstrated mild to moderate cognitive impairment, underscoring the impact of poor sleep on learning abilities. So sleep deprivation and academic scores were 22.5% were found to be sleep deprived based on the Pittsburgh Sleep Questionnaire. Academic performance, sleep deprived had a lower mean score, 64% compared to non-sleep deprived peers, 67%. 60% of the participants exhibited depressive symptoms based on PHQ-9 scores, and moderate positive correlation was found between the PSQ and PHQ-9 score, indicating that higher sleep deprivation is associated with the more depressive symptoms. And coming to the sleep hygiene scores showed a negative correlation with the sleep deprivation. This means that poorer sleep hygiene was strongly associated with the greater sleep deprivation. Cognitive function and sleep, coming to that, 65.7% showed poor cognitive function, mostly mild to moderate. So, according to WHO, sleep deprivation is a condition where one does not get enough sleep to support optimal health, alertness, and functioning. And our findings also reinforce that sleep deprivation negatively impacts the academic performance, mental well-being, and daily functioning. In our study, 43% adolescents who were sleep deprived showed depressive symptoms, reinforcing global evidence and the need for early sleep-focused intervention. JAMA Network Open meta-analysis confirmed a strong link between the disrupted sleep and depressive symptoms. So coming to the socioeconomic status and how does that influence the sleep hygiene? Adolescents from a lower socioeconomic backgrounds face shorter, irregular sleep due to environmental and psychosocial stresses. And regarding the sleep effect on the academic and behavior, In the Minneapolis School District, they have started delayed school started times led to a better attendance, a few discipline issues, and improved academic focus. In our study, 61% of lower middle class adolescents had a poor sleep hygiene, pointing to a clear vulnerability that needs a targeted support. Our data showed sleep deprived students scored 3% lower academically, reinforcing the need for policy shift like adjusted school timings, maybe. So, what are the recommendations? What we need to have a curriculum which for the capacity building, integrate school sleep education into the life skill via the Ministry of Education, train teachers, AFHSs, adolescent friendly health clinic counselors on adolescent sleep and screen time impact, access to mental health support like a display of Manas helpline in schools, train Ayushman Arogya Mandir teams for adolescent sleep counseling. Already it has been included in Ayushman Arogya Mandir school health initiative, public awareness and family engagement, leverage existing established platforms like Poshan Abhiyan, IC tools to educate the families, run digital detox drives for fixed routines and screen curfews. Physical and structural reforms are very important. So the perform physical activity via Khelo India, advocating for delayed school start timings aligned with adolescent biology, whether which may be decided by the ministries. Use of existing health, like utilize RBSK, RKSK for sleep hygiene messaging. Train school health ambassadors. So, good afternoon, everyone, and it is my proud privilege to welcome our guest of honor of the day, Dr. Zoya Rizvi ma'am, and Dr. Atul Kotwal sir, Major Kotwal sir. He is a ED Executive Director, NHSRC, and Dr. Ajay Swaroop sir, and Dr. NC Ganguly, Dr. Rao, and Dr. Nita Rana, and Dr. Beotra sir, Dr. SK Nandi, for being here to listen to uh, one of the very important lifestyle modification which we are going to talk about. We've been listening to all the reports which we have been hearing about the hypertension and diabetes, which has become very common in adolescent children, but sleep health also has been getting affected by all the lifestyle modifications the children are having these days. And first we are doing this study just to so we have just done this is a basically a cross sectional kind of a survey. uh, first, this is a panel discussion here. Yeah. Yeah, this sleep today.
And you can utilize this one mic also, no?
Okay. Yeah, I think it's better. Okay. So, prevalence of sleep deprivation and its association with cognitive function in adolescent, and this has been done in association with NHSRC, National Health Resource System Center. Dr. Neha Dimka, she was the lead consultant with us. So we have almost 1.2 adolescent children worldwide, and India is almost home to 21%, which is a 253 million adolescent children. So that is why it is a huge number. So which is affected by all these lifestyle modifications. And one thing which is very particular in the brain development of adolescent children, it is not basically the executive prefrontal cortex which normally deals with every executive function of the body. It gets matured by 21 years. It does not get matured by 16 to 17 years as is done by the other things. So brain development, sleep is crucial for learning and emotional regulation, linked to the academic underperformance and mental health. India lacks sleep education and policy for teens, and this study is trying to fill the gap with the database solutions. And 1 in 5 adolescents is
For enlightening us and providing us with the address. Sir, I'll introduce you first, so please.
Thank you. I think
Okay.
we'll save time on this.
Okay, sir.
Can remove- Yeah. Thank you. Sorry for interrupting you, but I think we have Dr. V.K. Paul sir and all the other dignitaries to listen to. So I think better to save time for that. So respected Honorable Member Health NITI, Dr. Professor V.K. Paul sir. So although a vote of thanks will cover it, but I think my duty to thank you once again for being here despite your busy schedule and all the other pressing commitments. And respected Dr. D.S. Rana sir, Dr. Ajay Swaroop sir, Dr. Bhalla sir, Dr. Zoya Rizvi, all the other dignitaries in the audience. I know I'm standing in front of various doyens of medicine and related fields, and also all the faculty and other team members from Ganga Hospital and my own NHSRC team. It's a great moment for us for this collaboration to fructify, and this kind of study which is there. We presented in the Ministry of Health also last week. It was really appreciated, and we'll see how we can go ahead from this. School health programs in India have evolved significantly over last 1 century. 1909 was the first formal school health program as such in Baroda, with only medical examination. Over the years, various kind of school health programs have been launched, but the sustainability and the actual yield for the school health program have been debatable till now. Even under the National Health Mission and the Ayushman Bharat, Ayushman ambassadors have been created. But my reason for requesting Dr. V.K. Paul sir to be here today, and I'm again grateful that he kindly consented and is here amongst us, because of sir's interest in child health and adolescent health, and also in the school health program. Under sir's leadership, NITI has revised the entire school health program, and the revised one is about to be launched as such, and that is going to be very, very executable, implementable, and will definitely provide us with the kind of intervention which we all have been waiting for since many, many years in the field of public health. The NHSRC, being the technical support to MoHFW, has been working in generating evidence not only in this field but also all the other fields, and that's how MOU with various institutions of repute, including Sir Gangaram Hospital. And this study, as you all know, as it was presented in the curtain raiser, and it was before the arrival of our chief guest. I'd just like to highlight a few important points. That it's unique and is giving the limited existing evidence. We have created this, although generalizability is that limitations we discussed earlier. But again, this kind of study was not available from India, any city in India, and it will be generalizable to several metropolitans in the India of similar kind of context, barring the private schools, which you now need to look at. But from lay evidence as such, the prevalence of all these may be more in those schools as compared to the government schools, which are covered in this study majorly. And few of the important findings, if you'd like to, I like to highlight that the prevalence of depression was quite high, and also the association of that depression with the scholastic performance was also directly linked in this study. As a way forward, we now need to start planning on how to use this evidence into improving our school health program further. So I will stop here, because I would like to listen to the guidance and further way forward from our expert, Dr. Zoya, also, and also our the blessings and guidance from Dr. V.K. Paul sir subsequently. Thank you very much.